Hey guys, Dr. Kyle Loveless here. Today I'm going to talk to you about rosacea. One of the comments I got on a psoriasis video is, hey, can you shoot a video on rosacea? So that's where here I am today. I'm shooting a video on rosacea, and rosacea is actually something we work a lot with in our office and help a lot of patients with. It's very similar in terms of what we're trying to do with the body. So today you're going to learn what some of the main things that lead to rosacea, number one. Number two, I'm going to give you some things to start to change in your diet and supplement-wise if you're someone dealing with rosacea. Maybe you have a friend or family member that is dealing with rosacea. And rosacea, you know, the redness of the skin, it can be very embarrassing because it typically is all over your face. And it can be, you know, life altering. It can affect how much makeup you wear, which can be toxic and worse for your body as well. Rosacea is something that we've gotten great results with from dietary changes and supplements, and that's it. And so I know the medical route's going to be the same like it is with anything else. It's corticosteroids. You know, I had somebody comment, that I'm not a dermatologist, and you're right, I'm not. I wouldn't want to be a dermatologist because their hands are handcuffed. Unfortunately, they've been taught in a system, in a model that says, okay, you have a skin issue. How do I get rid of this inflammatory skin issue? Well, I can do something to reduce inflammation, which is a steroid. And so they're really handcuffed in that area. Sometimes they'll do light, ultraviolet light and things like that, but it's typically just drugs and medications. And I would rather take the approach of finding the root cause of it. And I've had so many patients with rosacea and psoriasis and eczema come into our office that they've been going to a dermatologist for years, not getting any better. And then I talk to them, we teach them, we do testing on them, and their eyes are wide open afterwards, realizing, how did my doctor never tell me this? One of our patients actually works for a dermatologist for most of her career, and when she heard me start talking about psoriasis and eczema and all this stuff and how I was able to heal my own psoriasis through diet and through supplements and things like that, and she was like, wait, psoriasis is a gut problem? And she worked for a dermatologist for many years, and she didn't know psoriasis is an autoimmune gut issue, not a skin issue. So that blew me away. So yes, you're right. I'm not a dermatologist, and I don't want to be. And I would highly recommend, if you have skin issues and you want more than just covering up the area so you feel better in the moment, but you want to get to the root cause, because eczema, psoriasis, rosacea, these are underlying health issues that affect everything. They can lead to heart disease. You can lead to other health issues as well. So. All right, rosacea. So first thing I want to talk about with rosacea is, like many other skin issues, it has shown to go back to the GI tract. One of the main things that I found the research on, and I actually just didn't even realize this until I started researching more in depth. I've always said, okay, this is a gut issue. We understand that. We're working on the gut. But H. pylori is actually something that they find for a lot of people. So this Helicobacter pylori is a bacteria in the digestive system. When we don't have enough stomach acid, it builds up in our GI tract, creates ulcers and other gut issues. And it's very common with people with rosacea. And so I want to address that as well, and saying, okay, we got to get your stomach acid up, and we need to address the Helicobacter as well with certain supplements. But this study here is in Journal of Physiological Pharmacology. And what drives me crazy is all the studies I've learned and read and done, these are medical studies. And so your dermatologist should be reading them as well and addressing them for you as well. But what they found when they went through some of this study with Helicobacter is, number one, rosacea is a disorder in various gastrointestinal symptoms closely related to gastritis, so inflamed gut. The eradication of H. pylori leads to a dramatic improvement of symptoms of rosacea and reduction in related gastrointestinal symptoms. Cool. Gastritis, hypergastrinemia, and gastric acid secretion. Okay, so when we get your stomach acid in a good place, you get your H. pylori under control, and then you work on other stuff with the digestive system to get rid of inflammation, restore the microbiome. That's really when you're going to see the rosacea change. Now, that sounds great and sounds simple. It's not. It takes work. It takes dietary changes, because if you're still beating up your gut, it's not going to start producing acid properly. It takes really making bigger changes. Typically, things like antibiotic use over the years, poor diet, chemicals, other medications, high levels of stress will affect our stomach acid production. Those are the things that lead to this, okay? Rosacea could be considered as one of the major extragastric symptoms of H. pylori infection, probably mediated by the H. pylori-related cytotoxins and cytokines. So there you go. H. pylori is one of the main things that can cause it. And so I'm actually glad I'm doing this video because I learned that. Mostly just, it's still working on the gut, and that's what we always do. The next thing I'm wanting to bring up here is they've also showed deficiency in pancreatic enzymes and other digestive enzymes with rosacea. Again, going back to the GI tract. So if I look at that and I say, okay, we got digestive enzymes, we got H. pylori, what else is there? And there's some mineral deficiencies also that they've shown with rosacea, which makes sense. If you have a gut issue, you're not going to absorb minerals as well. If you have a gut issue, you're probably highly stressed, so your body's going to be deficient in minerals. If you have a gut issue, you probably had a poor diet and a lot of antibiotic use and possibly even other medications. So that all makes sense. So here, what do you do about it? Okay. Here's how we do it. Number one, you follow a non-inflammatory diet. Go ahead and go back to, I know this is about psoriasis that I'm telling you, but not rosacea, but go back to the video I did on psoriasis, the top 5 foods to remove for psoriasis. That's the same thing I'm gonna recommend you do with rosacea. So make sure you go back and watch that video. So that's the dietary change. Put in the good foods, your grass-fed, organic, free-range animals. Animals raised the way they're supposed to be raised, okay? Cows eat grass and eat green things. They don't have antibiotics and hormones. Chickens roam and they eat, seeds and bugs, things like that. Duck eggs are very effective for this kind of stuff because it helps in minerals and nutrient deficiencies. And then eat cruciferous vegetables. You're high, when it comes to vegetables, I like the big bang for your buck. So the broccoli, the Brussels sprouts, the cauliflowers, the broccoli sprouts, things like that. Very effective for things like this, okay? So you're getting your high nutrient value. Add some good probiotic type foods in there, like before your meal, try some sauerkraut, or maybe some kimchi before you eat. And then also before your meal, I want you to take digestive enzymes, something with lipase in it. They've shown deficiencies in lipase with rosacea. So something with lipase, or even get yourself a pancreatic enzyme that you can take before your meals. I would go ahead, because also gallbladder issues can lead to this, so I would go ahead and take bile salt, so TUDCA bile salts. So you got digestive enzymes, TUDCA bile salts, and then betaine HCl, okay? Good possibility that you're having stomach acid issues. So we're going to take betaine HCl to help your stomach acid, digestive enzymes to help you break down that food, bile salts to help you break down the fat so you can get your vitamin A, your vitamin D, E, and K, your fat soluble vitamins, okay? So those 3 things right there is your starting point supplements. The next 2 things the next thing I'm going to recommend is a supplement to help your good fatty acid levels. So something like cod liver oil for your EPA, DHA, or any kind of good fish oil is going to be the next step, just overall autoimmune responses and immune system issues in general. Next on here in the minerals, okay? So get yourself a good trace mineral mix or a multivitamin. You're gonna want stuff like copper, you're gonna want the things like folic acid, B vitamins in there, and then a mixed multi-mineral with your zinc, your copper, things like that, a B vitamin complex, and then the final thing is nicotinamide, okay? And we'll have that written down there. But nicotinamide is also something that's been shown very effective in deficiency with rosacea, okay? So to repeat, we got stomach acid, HCl. We're gonna take betaine HCl. You're gonna take digestive enzymes with your meals. You're gonna take pancreatic enzymes with your meals. TUDCA bile salts, okay? Fish oil, some sort of omega-3 fatty acid, get a good quality fish oil. And then you're gonna do a multi-mineral. Cool? And make sure there's trace minerals like copper and boron and things like that in there as well. Do those things, non-inflammatory diet, those supplements right there, and do this for a period of time. Don't do it for 2 weeks, don't do it for a month and say it didn't work. Follow that for a period of time. If you're going for about 2 months and you're doing this and nothing has changed, you need to investigate more. The next step is testing to see, maybe it's food allergies, maybe you need to remove certain foods that are creating inflammation in your gut. Maybe you need to look at your stool and see what's happening in your digestive system. Maybe it's more than H. pylori as an infection or tons of yeast buildup. Could be a lot of different stuff, okay? But the first step is what I just said there. Okay, so hopefully that was helpful for rosacea. Hey, in the links below, make sure in our links below, we have our different groups, like our Facebook group and things like that, that you can constantly just be asking questions on. And if something in this video made sense to you, please share that with us. If you have any questions, please share that as well. We try to answer all the comments and just continue to grow this channel so we can help more people ultimately become their own health expert. Thank you guys for watching, and y'all have an awesome day.